Next up, Juls Budau, master student, University in North British Columbia. I'm so sorry for this massive clock.
What are you apologizing for?
The big clock.
Oh, yeah.
It brings a lot of stress.
No, yeah, that's fine. So hi, my name is Jules. I live in British Columbia. I'm here to present on findings from a study conducted by researchers in Ontario entitled Experiences of Stigmatization Among People Who Use Drugs in the Initial Year of BC's Drug Decrim Policy. So while the evaluation is done by external researchers in Ontario, they employ people in British Columbia who access services and who use drugs, and I am one of those people, and so I'm on the Decrim working group. So a little bit of background about Decrim. In January 2023, BC became the first province to decrim possession of some illegal drugs as part of a 3-year project. Of course, there were limitations. You had to be over 18. It was only up to 2.5 grams, which was a bizarre amount. It's not even an 8-ball. And only these few substances, opioids, meth, cocaine, and MDMA. And the intention was to reduce barriers to harm reduction, recovery, and health services, particularly stigma, which was identified as a barrier. I just wanted to comment that Talia's analysis was spot on. The combination of decrim without the investment in resources really caused decrim to backfire quite a lot. At the time, there was increasing homelessness across BC. And there are many communities in BC that don't have overdose prevention sites at all, and there are no communities in BC that have 24 access to overdose prevention sites. So of course, this is going to result in a lot of public drug use, which was then sensationalized and exaggerated by right-wing media and politicians. But we did the study, so we wanted to examine how the policy actually impacted stigma within the first year of implementation. And so 100 drug users were interviewed over the phone, and it was analyzed thematically by the Decrim working group. The participants were asked about stigma they experienced. So there were 3 types of stigma: societal stigma, the way the public feels about and treats drug users; structural stigma, how laws and policies regarding drug use create marginalization, particularly in healthcare; and self-stigma, which is the internalized beliefs participants have about themselves because they use drugs. So there were 4 key findings. So 1, pervasiveness of stigma. So most participants said all forms of stigma remained pervasive despite the policy, gave examples of derogatory language from the public, discrimination in healthcare, and persistent internalized shame. So here's one quote from a participant about her experiences at the local hospital, saying, "The stigma in the hospital is still very much the in-out, the users, the junkies, get them in, get them out, the less care the better. That's been my experience." And I wanted to note that rural users were impacted disproportionately by this due to enhanced visibility in their communities. But there were mixed experiences, so there were some evolving experience. While stigma was worsening or the same in some realms, some noticed a reduction in other realms, and that some people were beginning to demonize drug users a little less and humanize them a little more. But there was optimism for long-term change. So participants expressed that over the long term, the policy could reduce stigma for them, especially if combined with other supports. So as one participant said, Decrim has just touched the tip of the iceberg. I don't think anything's changed yet. It's just starting to brew. So again, this was conducted in the first year. By the middle of the second year of Decrim, it was rolled back to recriminalize possession of drugs in public places, which does recriminalize most drug users. But participants did have recommendations about what these supports could be. So expanding harm reduction sites, particularly safe inhalation sites where people could smoke drugs, as because of the switch from heroin to fentanyl, most people do smoke now. Increasing the availability of housing, both of which would reduce public drug consumption by providing less visible places to consume drugs. And participants also recommended public education campaigns and law enforcement training in order to challenge misconceptions about decrim, addiction, and illicit drug use. So in conclusion, we learned for participants that in order for Decrim to achieve its full potential and actually decrease stigma, it needs to be supported by broader systemic change. That includes providing education for both law enforcement and the general public, as well as more resources for drug users, particularly for our unhoused community members, such as housing and harm reduction services, so people can consume drugs in places that are private, safe, and dignified. So thank you. Here's my contact information, and thanks to CRISM Ontario for supporting my participation and in getting me here. Thank you.